Heyo, my name is Alex Barker. I'm a clinical pharmacist, and I am about to answer Ju-Hung Park's questions about pharmacy. We're both fellow Bulldogs, so I'm really glad to do this favor for him. And so let's dive right into these questions. First one is, what kinds of communication, especially writing, do you do on the job? I spend a lot of time communicating. I am not really off it by myself. I do communication with the patients. Typically, this is done over the phone, where I'm calling them, asking about their latest labs, talking to them about drug therapy, and that's typically what I do mostly with patients. I do quite a bit of writing in the electronic medical record. I document a lot. Actually, that's what I feel like I spend the majority of my time doing, is documenting what I'm doing, what I talked about with the patient, discussions I had with healthcare providers, that sort of thing. The next question is, with whom does this communication occur? With whom? Man, I don't talk like that. Typically, like I said before, I talk a lot with patients. I do a lot of that. I talk with healthcare providers, doctors, nurses, nurse practitioners, PAs, lab techs, clerks. So I talk to a lot of people in healthcare. Next question. What kinds of skills and qualifications does your job require in addition to dispensing medication? I actually don't have the privilege of dispensing medications, so I don't put pills in a bottle, I don't check them, I don't do any of that kind of thing. The skills that I really need for my job are basic critical thinking skills. Being able to assess data, come up with a conclusion supported by the data, and then changing drug therapy based upon those conclusions. Also, a huge critical skill that I don't think you can really learn in college, but more so just being around friends and doing different jobs, is basic people communication skills. I mean, if you're going to be a clinical pharmacist and you need to convince someone to change the way that they're living, or maybe it's their eating habits, their diet, and they just don't want to change, you need to be able to, number one, talk to that person, talk to them about the barriers they're having, and then how to overcome them. And that's really hard to do. You know, you can't just learn drug therapy and all of a sudden people are just going to listen to you because you sound smart, because you know how metformin works, or you know how to calculate serum creatinine, or you know, pharmacokinetics, which you totally use, by the way. Anyways, learning how to talk with people, relate with people, is a skill not taught in college, at least not in my experience. And by far, learning how to relate to people, learning how to listen to people, is a skill that is insanely valuable in the workplace. And if you can treat people like they are the most important person in the world, well, then you're going to be their favorite healthcare provider. You're going to be a person that is going to be highly sought after in the workplace, because I can tell you that there's a lot of people out there who hate their jobs and they complain about it every day. And I'm sure you've seen this on forums and such, and people complaining, there's too many pharmacy graduates out there and the job market sucks. Well, the people who complain all the time are going to be the people who likely may lose their jobs. And if you're a positive person, if you're the kind of person who values people, then I think that you're easily going to find a job anywhere you go. The next question is, what expectations and surprises you had entering the profession? Good question. I did not expect politics. And what I mean by that is learning how to deal with people who don't see eye to eye with you. I've had people disagree with me strongly on things. I've had people complain to my boss about the way I interact with people, and I know that I have that problem. I know that I don't communicate extremely well. I'm a single child, or an only child, whatever you want to say, and I know that that has stunted my personal communication growth. I was really shocked by how laid back actually people are. You know, for a while I treated what I did with such high regard and such delicacy that sometimes I was scared to make decisions about drug therapy. I was scared to approach doctors sometimes about decisions that I wanted to make. And I've just found that, you know, once you get your feet wet, these practitioners who have been in 10, 20, 30 years are a lot more laid back about what options there are for patients. They understand that, you know, if they increase the dose of something, more than likely, if you're monitoring it, it's not going to kill them. But I was almost paralyzed by my decision-making ability. I felt like if I make the wrong decision, something awful could happen. So I was really surprised by just getting my feet wet and how much of a newbie I was, I guess, and getting used to the fact that it's okay if I make the wrong decision. As long as the patient's safe, we can always go back and change the decision we made, and explaining that process to the patient as well. The last question that Ju Young asks is, how do you see the profession of pharmacy defining itself? I'm not really sure what the question is asking here, because if you look in the Webster's Dictionary, you'll find the definition of pharmacy. But maybe it's asking, where do you think the future of pharmacy is going? Maybe that's the question. And if that's the question, I think provider status is eventually going to happen. It's February 5th or 4th or something like that. And I know that within the last few weeks, 2 bills went in front of Congress to push forward the agenda of getting pharmacists into provider status. I think that transition is going to make our roles way more clinical. I firmly predict that pharmacy technicians will become more responsible. I think that because of the training that they're implementing on them, that they are going to make them responsible for things like refills in retail pharmacies. I think you're going to see less mundane tasks be placed on pharmacists and have more clinical decision making and more clinical roles, especially in retail setting. I don't think this is going to happen in the next 5 years, maybe 10, maybe 20. I also think that there are way too many schools out there, and I think that the graduates going into the workforce are not well enough prepared to handle the increased competition. And I'm really actually scared for you, the next generation of the pharmacist, because it's going to be very, very difficult for you to find a job that you will love. That's why I highly recommend that you start investing in yourself now, whether that's taking on extra projects, helping professors complete their projects, getting research done so that you can look good for residencies. I don't know exactly what your goals are for your career, but you need to start building your brand now so that people, when they hear about you, they think, yeah, I want to hire this person. Because just being a PharmD isn't going to cut it anymore. Just having a degree is not going to be something worthwhile. You have to put in the time now to build your career, because it's going to be very difficult now to find a job. I'm actually really scared for every new pharmacist because the competition is fierce. Unless you move to places like the middle of nowhere, Nebraska or Wyoming, you're not going to find jobs that have low competition. You're going to see jobs within the cities have 60, 70, 80 applicants, all for one position. So do what you can now to build your own brand around hopefully excellence in a certain area, and be willing to put in the time and effort to make yourself stand out above the crowd. Shameless plug, I know. Check out my website, pharmacyschoolhq.org, and on that website I talk about how to make yourself competitive. I have a lot of information for pre-pharmacy students, but I do have a lot of information about interviews and residencies, so check out that if you'd like. Thank you so much, Ju Hung, for letting me do this, and I wish the best of luck in your pharmacy career. Keep in touch. Let me know if I can do anything for you. So until next time, sayonara.